it can be difficult, even at expert centers, for patients presenting with any form of fibrotic interstitial lung disease to make an accurate diagnosis. And this is taken from a recent paper that provides an algorithm that I think is helpful to all of us who are in the clinical trenches. First of all, the way this leads us is whether or not there's a leading diagnosis that meets guidelines criteria for a confident diagnosis. And when we say confident, a greater than 90% likelihood that this is the disease we're dealing with. If that's the case, you can make the diagnosis. But what about those cases where the level of confidence isn't quite the same, where you're suspicious of IPF, for example? And if you have a greater than 50% likelihood that the patient has this diagnosis, you can provide a provisional diagnosis with either high confidence or low confidence, shown in the two categories here. If you are 70 to 90% certain that this is the disease, you can make a provisional diagnosis of, for example, IPF. If you only have low confidence in the clinical features, the radiographic and the pathologic, then you can make a provisional diagnosis with low confidence. And if you're not confident at all, and there's a less than 50% chance you're dealing with IPF or any other specific disease entity, then you might be left with this very broad wastebasket term of unclassifiable interstitial lung disease.